All right, good morning. I'm Dr. Sarah Keep, and this is Jenny. She's joining us today. I'm an optometrist at By Design Optometry, and we are going to spend a little bit of time today talking about some lenses that we like to prescribe to patients called the Shaw lens. So this is a certain type of lens that can help some patients that have certain visual issues or binocular vision issues.
So first of all today, what are Shaw lenses?
Shaw lenses, as I mentioned, they're a special type of lens. They're called an isoconic lens. They're designed for patients who have Anisometropia, which we'll talk a little bit about later. So Anisometropia is a condition where there's a different prescription in each eye, and then the Shaw lenses are really helpful in providing the best optical quality for patients with this condition.
Oh, nice.
Yeah.
And can you explain to us how they're different from conventional lenses?
For sure. So if a patient has Anisometropia, they have a different prescription in both eyes. So basically what that results in is they have a different power. When we put a pair of lenses in front of our face, the optics of the lens will change where images are located in space, and they'll change the size of the image. So if you have one eye that has a stronger power than the other eye, it will cause an image that's either more, more magnified or more minified than the other eye. And it will also cause those images to be located slightly further away or slightly closer to the eye. And this can really impair a patient's ability to be able to fuse those images and use the eyes together as a team. So it does have a negative impact on binocular vision if patients are wearing a conventional lens. The Shaw lenses are different from conventional lenses in the sense that they equalize the magnification between both eyes so that the images, despite having a different power, have the same size and are located in the same space so that the eyes can move together and easily fuse those images.
Yeah. What is anisotropia and how is it associated with amblyopia?
So as I mentioned, anisometropia is a condition where the power of the eyes are different, so that results in a different prescription in both eyes. So when one eye has a higher power than the other, it ends up having a clear image in one eye compared to the other when it's not corrected with glasses. And the brain doesn't like to fuse these uneven images together. So it just becomes lazy and ends up suppressing the eye that has the higher power and relying on the image from the better seeing eye, which results in a condition called amblyopia, which is an eye that doesn't have the same level of vision as the stronger eye. So it is something that we do want to make sure patients with anisometropia do have correction to both eyes so that their brain can gather visual information on both sides.
Okay.
Yeah.
And Sarah, can you tell us what is refractive amblyopia and how is it commonly treated?
For sure. So refractive amblyopia is amblyopia that is developed from a prescription for glasses. So there's two types of refractive amblyopia. One of them is when you have a really strong prescription in both eyes, so the image to both eyes is blurry, and then you develop amblyopia in both eyes. Or you can have anisometropic amblyopia, where because you have that uneven prescription, you develop amblyopia in one eye because your brain ends up suppressing the weaker seeing eye. So typically when we're thinking of Shaw lenses, we're thinking of anisometropic amblyopia.
Oh, perfect. How do Shaw lenses change the treatment options for amblyopia?
So the goal for amblyopia is to try to provide a clear image to both eyes so that they can work simultaneously. So traditionally, somebody who has anisometropic amblyopia, we would ideally want to fit them with a contact lens because contact lenses don't result in uneven magnification. However, some patients aren't candidates for contact lenses. So if children are, really young in age, where we can't get a contact lens in their eyes, or if they have, mobility issues, for instance, where they can't physically get a contact lens in, or, issues with dry eye or anything like that. If they can't wear a contact lens and they have to wear glasses, then we obviously want a lens where it's going to have the best optics and the most equal optics between both eyes, because otherwise it's a barrier for binocular vision. So Shaw lenses are one of my treatment options that I offer to patients who have anisometropia, whether or not they have amblyopia, just because it does provide the best, most equal optics to both eyes.
And what is anisoconia and how do Shaw lenses help?
So anisoconia is an uneven image size that's presented to the back of the retina, which is often due to anisometropia. So Shaw lenses help with anisoconia because they basically equalize the image size by equalizing the magnification of the lens. So basically what this results in is it presents two equal images to the back of the retina, which are much easier for the brain to fuse those together. So it does improve binocularity when you do have equal image sizes. So the Shaw lenses are really effective at this. Another thing that can be challenging for patients if they do have anisometropia is as the magnification is different on each lens size, their eyes actually have to move at different rates on one eye versus the other as they gaze through the lens. And if we can equalize the image magnification and location, then they can actually move their eyes together. So these lenses are much more comfortable for patients. They reduce a lot of symptoms like headaches and eye strain and stuff like that.
Okay, can you explain some symptoms of anisoconia?
For sure. So oftentimes patients will come into the office and they'll complain of symptoms like their glasses just aren't comfortable, or they're getting headaches or eye strain. Some patients will complain of double vision, and some patients will complain of blur, which is actually just a minor form of double vision. So basically what happens, as I mentioned, if you have two uneven image sizes and you have a big image and a little image that are overlaid on top of each other at slightly different heights, you're going to get almost like a shadowed double image effect, which can appear as though the image is blurry. So this obviously leads to a lot of discomfort. So patients can have anything, as I mentioned, headaches, eye strain, blurry vision. They can also feel disoriented if the two images are located at different locations in space, because it kind of alters your visual spatial perception. So sometimes patients feel a little dizzy and imbalanced. So if we can equalize those images, it dramatically helps to improve symptoms, because instead of you having to put so much power into trying to fuse those uneven images, they just fuse automatically. So it dramatically reduces discomfort if you have an isoconic lens such as a Shaw lens.
How can someone schedule an optical exam with Vision by Design?
So we actually prescribe Shaw lenses just during our routine eye exams. So if patients come in, if they feel like they're experiencing symptoms of anisometropia or anisoconia, they can certainly come in and just have a routine eye exam. So if they have a significant amount of anisometropia, we always have a discussion with the patients about their symptoms and see if they are potentially due to anisoconia or that uneven image size. And if they are, we often do recommend a Shaw lens. These lenses do require some additional measurements that have to be done by the doctor. So the doctor measures basically your ability to fuse images together using different prisms and stuff like that. And that's one of the factors that the Shaw lens is used to manufacture these lenses, to equalize the image and allow greater fusion. So yeah, it's quite an easy exam, just a routine comprehensive eye exam with a couple of additional measurements is all that it takes. So if patients are interested in booking an appointment, or if they think something like a Shaw lens will be beneficial for them, they just have to either head over to our website, they can book online, or phone our office at 780-444-6407.
Great, thanks, Sarah.
Yeah, you're welcome. So I hope everyone found that to be interesting. I think the Shaw lenses are really great. We use them all the time in the office. They do definitely improve visual comfort for patients. As I mentioned, I'm Dr. Sarah Keep from Vision by Design Optometry, and if you liked us, feel free to give our page a like or subscribe to our page. We'll see you next time.